Okay, Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom and salam sejahtera. We are from Small Group Discussion B1. Would like to do a presentation of our student project with the title Gender Dysphoria. Next. These are the members of Small Group Discussion B1. Next. These are the table of contents of our student project. Next. So my name is Maylenzky from Putri, and I would like to explain about the background information. So there are two terms that we usually use but have different meanings: gender and sex. The biological sex of someone indicates whether the person is female or male, depends on their genitalia and chromosome. On the other hand, the term gender is more likely to describe how someone identifies fits in social norms. Some people may confront an untypical body structure and suffer perception imbalance, which some call as gender dysphoria. According to the Diagnostic and Statistical Manual of Mental Disorders, gender dysphoria is when they express their gender and the ones they're given at birth isn't congruent. Childhood maltreatment, neglect, and also physical or sexual abuse have been found to be associated with gender dysphoria. Individuals with gender dysphoria may experience a desire to get rid of one's sex characteristics and a desire for to have another's. Youth who are in early steps on questioning their birth assigned gender may feel uncomfortable due to the pressure given by the family, peers, or the community itself. Stress and pressures due to stigma may contribute to chronic stress and also negative health outcomes. That's all for me. Next.
My name is Alamanda Candra, and I'll continue the presentation. So I'll explain about the statement of problems. Number 1, what is the general overview of gender dysphoria? Number 2, what is the epidemiology of gender dysphoria? Number 3, what is the etiology and risk factors of gender dysphoria? Number 4, what is the pathophysiology of gender dysphoria? Number 5, what is the diagnosis and differential diagnosis of gender dysphoria? Number 6, what is the treatment of gender dysphoria? Number 7, what is the prognosis of gender dysphoria? Next. So as for the purpose of this study, we will able to know the general overview, epidemiology, etiology, risk factors, pathophysiology, diagnosis, differential diagnosis, treatment, and prognosis of gender dysphoria. Next. So for the benefits of this study, we will able to know the general overview, epidemiology, etiology, and risk factors, pathophysiology, diagnosis, differential diagnosis, treatment, and prognosis of gender dysphoria. Thank you.
Hello everyone, my name is Stevanus Surya. So I will explain about general overview of gender dysphoria. So gender dysphoria refers to a discrepancy experienced by a person regarding two things, namely the gender identity expressed by a person with their biological identity at birth. Patients with gender dysphoria will have a strong desire to become the opposite sex, which is characterized by changes in the patient's attitude, behavior, and the development of dissatisfaction with their genital organs that lasts at least 6 months. Several factors that can cause the development of gender dysphoria in a person, including biological factors such as hormonal and genetic, environmental approach, rare conditions, drug and chemical exposure during prenatal period. That's all for me. Next.
Okay, my name is Devi Savita, and I want to explain about the epidemiology of gender dysphoria. So the prevalence of transgenderism varies internationally due to differences in cultural and social norms and different definitions. In 2017, a sexual health study was published. The prevalence reported in the DSM-5 is a markedly high prevalence ranging from 0.5 to 1.3% in children, adolescents, and adults. According to an analysis of the national probability sample in 2016, about 390 of 100,000 adults were transgender. Furthermore, according to data from a national survey, about 1.4 million people in the United States identify as transgender. Next. Here, some studies show about 28% have reported a drug use problem, 43% have had suicidal ideation, and 23.8% have attempted suicide at least once in their lifetime. Next.
My name is Putri Devi, and I would like to explain the etiology and risk factor of gender dysphoria. The etiology of the gender dysphoria is uncertain, but there are some factors that may result it, such as hormonal factors. First, hormonal factors. The occurrence of abnormal conditions between sex and gender in the mother's womb can be triggered by hormonal factors due to the crossing of hormones such as androgen and estrogen that causes children to experience gender dysphoria. Second, drugs and chemicals during prenatal period. Exposure to drugs and chemicals during prenatal period also causes gender dysphoria by the presence of pellets in plastics and polychlorinated biphenyls that affect in utero. Third, genetic factors. Research found that gender dysphoria was occur as an association between several alleles such as CYP17 and CYP17-374C and also chromosomal abnormalities. Next. Fourth, rare conditions. Rare events or conditions can be one of the causes of gender dysphoria, such as congenital adrenal hyperplasia and intersex conditions, which is hermaphroditism, or a condition where children born with two sex organs. And fifth, environmental factors. Unbalanced normal human interactions, such as lack of or wrong emotional ties and relationships between children and parents, and also poor parenting can trigger for experiencing gender dysphoria. Thank you. Next.
Okay, so my name is Amadeus Fernandito Leksana, and I will explain about the risk factors. So based on growing evidence, it is found that patients with autism, high rates of depression, attempted suicide attempts, and also excessive substance usage had a high risk of getting gender dysphoria. Next will be presented by my friend.
Okay, my name is Chandra. I will be presenting about pathophysiology of gender dysphoria. Although the research in gender dysphoria pathophysiology is still in debate and sometimes inconsistent, there are primarily two mechanisms in which gender dysphoria arise: biological and physical-social process. In biological model, it is believed that the biology itself either permit, affecting, or affecting indirectly this process. Direct biological processes include gene and hormone influence in brain activity, mainly difference in androgen hormone exposure in prenatal stage between different time frame of brain development and genital development. In indirect and permissive model, biology acts as a neural machine in which the relevant formative experience must still occur, and the brain only facilitates the response after the formative experience itself. One of the main examples are how songbirds learn their song by experience. Next slide. The next is psychosocial model, in which there are parental factors such as closeness to mother, absence of father, and lack of parental dynamic. The other parental factor include desire of having opposite gender daughter, which may change how mother behave, and the mother may persuade their children into activities not suitable with their child's biological gender. In non-parental factor, childhood abuse are also known to contribute in gender dysphoria pathophysiology. Next.
My name is Putu Damaghita Laverda Suri with last 3-digit student ID number 036. So I would like to explain about the diagnosis and also differential diagnosis of gender dysphoria. So how we can identify gender dysphoria. So in diagnosis process, physicians usually use behavioral health evaluation and also DSM-5, where behavioral health evaluation is used to evaluate the incongruence of the individual gender identity and sex which has been given since birth, the history and development of the individual feelings, and then the impact on the mental health and how the surrounding support the individual. In the other hand, DSM-5 is used as the parameter to separate the specific gender dysphoria criteria between children group and also the adolescents and adult group. There are 8 main criteria, which each of them have the specific criteria that must be fulfilled by the patient, so it can be diagnosed as gender dysphoria. Next. So while diagnosing the patient, physician might find some other symptoms that fit the criteria of other diagnoses, such as body dysmorphic disorder, sex disorder, psychosis, or even schizophrenia. Thank you. Next.
Okay, hello. My name is Gede Ngurah Winata. So in this presentation, I will cover about treatment. So first is the treatment for the children. Based on Kaplan Insider Comprehensive Textbook of Psychiatry, state that there is no approach in the center hormonal or surgical intervention for treating children patient. But we can also use some approach to treating patient with GD or gender dysphoria. The first approach is to focus on lesion dysphoria and decrease cross-gender behavior and identification the children with the caregivers. This is based on assumption that children identified GD in the childhood will likely to persist. The second approach is called the Dutch approach, is making no direct effort or remain neutral with concerning gender identity outcome on GD children. This based on the evidence that GD identified in childhood is likely to be lesion in the adolescent or more. And the last approach is to have mental specialists, family members, and others to confirm the child transgender status. Next. The next is treatment for adolescent. So treatment for adolescent is created by two groups. Number one is the who is persists their GD in the childhood and still in the adolescent, and group number two is adolescent with new onset of GD. So the existing research might not sufficient to support AP practice for guideline for treating the adolescent, but there is some recommendation based on consensus that for treatment. Number one is psychological and psychiatric assessment. Number two is psychotherapy. Number three is documentation to specialists in other discipline. Number four, psychoeducation of family members and institution. And the last is assessment of family, school, and community safely. Thank you.
Okay, so my name is Amadeus Fernandito Leksana, and I will explain about the treatments for adults. So as in the case with gender dysphoria in childhood and adolescence, and for similar reasons, there are no RTCs have been conducted for any treatment intervention in adults. It is difficult to agree on a therapy goal other than boosting the individual's sense of well-being and ability to operate in general. But there is a recommendation that can be made on treatment GD in adults, such as first assessing and diagnosing patients' gender concerns using DSM criteria and ensuring that they are adequately addressed. Then assessing and correctly diagnosing any coexisting psychiatric disorders and ensuring that they are adequately addressed. Next one is distinguishing between GD and concurrent psychiatric illness, as well as gender manifestations that are not GD, but rather psychopathology epiphenomena. Next one is engaging in psychotherapy with gender variant individuals, and then ensuring that individuals who are transitioning or who are considering or planning to transition receive complete counseling from a qualified professional. Then determining eligibility and readiness for hormone and surgical therapy, or locating professionals capable of making these determinations to whom the patient may be referred. And then educating family members, employers, and institutions about GV, including GID. And the last one is ensuring that documentation, including letters to endocrinologists and surgeons, uses terminologies that facilitates communication well. So that's all from me. Next one will be presented by my friend.
My name is Bertrand Wijaya, and I'm going to explain about the prognosis. The prognosis of the gender dysphoria is broadly positive and improves with treatment. People suffering from gender dysphoria don't need to live in silence and isolation any longer. Gender dysphoria treatment, which may consist a combination of psychotherapy, hormones, and surgery, are safe and effective in the long run. Even though the surgery is successful, transgender people has to undergo high level of stigmatization, discrimination, victimization, which can lead to negative self-image and escalated likelihood of other mental disorders. Nonetheless, only very few people who select gender reassignment surgery have remorse
about their selection in later years. Whether choosing hormone therapy or combined with surgery, the goal is for people to no longer have gender dysphoria and feel at ease with their chosen identity. Thank you.
Okay, my name is Bagus Gede Manuaba, and I'm going to explain the conclusions of our student projects. Gender dysphoria is the feeling of discomfort or distress that might occur in people whose gender identity differs from their sex assigned at birth or sex-related physical characteristics. Symptoms of this sexual disorder present at different stages of development for each individual, but mostly at the secondary sexual characteristic development stage. There are several factors that cause the development of gender dysphoria in individuals, including biological factors such as hormonal and genetics, environmental approach, rare conditions, drugs, and chemical exposure during prenatal period. Treatments on gender dysphoria differs between children, adolescents, and adults. Next. And this is our references for the student projects. Okay, that's all from us. Thank you for your attention.